Hi, this is Dr. Tasman Cordie. I have a functional medicine practice in Little Silver, New Jersey. And the diet that's best for fibromyalgia is the diet that's probably best for most human beings. Typically, the first thing that we need to start with in a patient who has fibromyalgia is reducing the amount of carbohydrates and sugars they have in their diet. And usually we're going to start slashing out the processed stuff, okay? Anything that comes with a label on it. And certainly sugars are a huge trigger for a couple of things. They're certainly triggers for pain to increase, and they're also triggers for the immune system to decrease function. And so we want to remove sugars, but we also remove the refined carbohydrates because they're just empty. They don't have the nutrients available to process them, and so they end up causing more problems. They end up causing more overt B vitamin deficiencies, which when B vitamins are really deficient, that causes energy problems. And we know many people with fibromyalgia have fatigue, and causing more fatigue by eating processed carbohydrates is going to cause more problems because of a lack of B vitamins. And B vitamins are energy vitamins. They help us feel better. They help us feel alert. They help our brain function. They help our heart function. They help everything function, really. But they help our energy handling system work properly. So definitely that's a big first step. The next thing is adding in more fats. Most people don't eat enough good fats. And so good fats are sort of a list of things: avocado oil, macadamia nut oil, olive oil, butter, ghee. If you can eat those butter and ghee things, unless you have a dairy allergy, of course you can't have those. And then just the normal fats that are found with proteins in nature. So like the skin on chicken, and the marbling that's found in red meats like beef and lamb. If you eat lamb, some people don't. But the natural fats that occur in nature with foods we have, so the yolk and the egg white, or nuts have a natural amount of fat and protein and carbohydrate. So we start to add more of those good fats in, which are really important. Fats are essential to supply enough energy for our system to function optimally and run calmly all day long. Fats are what make up most of our brain and our nervous system. And we know with fibromyalgia, of course, it's a central nervous system processing problem, and it over-responds to stimulus. And so we want to be able to give the nervous system exactly what it needs to function properly. And structurally, if we know it's mostly made of fat, we need to be eating a lot more fat. And then usually people eat enough protein. Vegans and vegetarians aside, usually people eat enough protein to have enough raw materials to rebuild tissues. So I don't worry too much about the adequate protein. I worry more about too much protein, because that will stress digestion and cause some unnecessary stress on the whole digestive system. But typically we do pretty well with cleaner proteins, and we will talk a little bit about cleaner proteins like grass-fed animals and free-range animals, because all of those fats that we get from the animals and the proteins that we get from the animals are, of course, made from the food that they ate. So the cleaner the foods that they eat, the cleaner the animals are for us when we eat them. So way more fats, way less processed sugars and carbohydrates. And really it's a less to none, and none is best answer with that. And then just adequate protein, not too much, but enough. And it's my vegans and vegetarian patients who I need to worry a little bit more about getting adequate protein in, but typically we can do that through a variety of nuts and seeds, sometimes beans and legumes, but it just depends on whether or not they can handle the beans and legumes. And not everyone can handle those really well and continue to heal because of the digestive issues that they'll cause sometimes.